Welcome, 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 my Be Health Empowered family, back to another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark, also known as Dr. Mel. We are just delighted to be back here with you this week, bringing you all the information that you need, the up-to-date information that you need to make wise health decisions, not just for yourself, but also for your family and even for your community. And we know in these times that is more important than ever. So thank you for tuning in. And if you're joining us for the first time, my newbies out there, please know that we are here to answer your questions. And we love it when you put those in the chat, you put your comments in the chat, and just in general join in all the wonderful, fun, exciting things that we are creating here with you. And also, if you are part of my Be Health Empowered family already, you know that I cannot do this alone. I have to have my wonderful co-host, Mr. Wayne Bruce and Miss Lila Mays, to join me. So, hey y'all, how you doing?
Hey, happy
Howdy.
Monday.
Happy
Howdy.
Monday.
It's Monday.
And I have to also remind everybody, I'd hit that like button if you're checking us out on YouTube, and the like button if you're checking us out on Facebook, and the subscribe button if you're checking us out on YouTube. We greatly appreciate you for that.
We do. Dr. Mel, you're going to have to get that straight before we come on, because when we come on, it's just about us.
Right. Well, it is about you because they're liking you too.
All right.
I'm just saying.
Better. Make me feel
Okay.
better.
So what's going on today? What's happening with our show? What are we getting into today?
Well,
what are we getting into today, Wayne?
We're going to talk about the largest organ people just don't know about. That's what we're talking about today.
I know. It's crazy when you think that skin is the...
We just lost Lila. We just lost her voice.
We can see her.
We see her. Say something, Lila.
Well,
we just...
Well, while we're waiting for her audio to come back, you're right. We're talking about skin today, and it is the largest organ. And it's not just the largest organ, it is the most visible organ on our body. So everybody has something to say about it. Everybody has an opinion, right?
Yes. Everybody has an opinion.
Everyone has an opinion. Can you hear me now?
Yes, we can hear you.
Okay, great. I was going to say, every time we log into social media or we're doing something, watching television, all kinds of commercials about best kept secrets and hacks for good skin. And who knows if they really work or people just trying to get our money. But we're going to get into how to take care of the skin today.
And, remember when your parents or grandparents used to tell you stuff like, stop eating that chocolate, it's going to break you out. I'm just telling you, from a fat kid's perspective, we did not care. We was going to eat some chocolate.
And you had perfect skin anyway, right?
Yeah. We ain't worried about skin. We was worried about calories. And not in a good way.
And I don't know about y'all, but nobody in my family ever bought sunscreen when I was growing up.
Oh yeah, so, they were gonna say that's not for us. That's for them.
Right.
Like, well, who is the them? I ain't find out the them was white people till I was old. I was like, who is the them? When you're a child, you like, why is the them? Why are they not telling us who the them is?
Well, the bottom line is, regardless who the them is, we need to talk about what these skincare myths are and all of that. We're going to put it under the microscope today. And we have an incredible guest, a dermatologist, skincare expert, Dr. Paula Bourelly. She's going to help us go through all this stuff and sort fact from fiction and break it down and help us better care for the largest organ on our body, our skin.
I'm excited.
Yeah, it's going to be good.
She's fantastic. Good stuff. She's fantastic, right? Yeah,
All right.
I had when I ate that triple Dodoberg egg, and I broke out all over. I was trying to find out what was going on with my skin. I found Dr. Bourelly.
Okay. We're not even going to ask about the triple Dodoberg egg. I think we probably just need to go straight into the weekly recap.
Do we? Okay. All right. Here we go.
All right.
There we go. The week
All right,
that was.
everybody. The week that was, and as you can see, measles is number one because measles is making a daggone comeback. What in the world is going on with these measles outbreaks?
Yeah. We've had 3 outbreaks just since the beginning of this year, 2025, involving over 160 people. And unfortunately, last week, a child died, which has not happened in over 10 years from the measles. So it's some serious stuff going on now.
So why now? What's going on that's leading to these outbreaks?
Well, there's a lot of evidence that it's the lies and misinformation about vaccines not being safe, and it's leading to lots of people or enough people not getting their children vaccinated, and therefore falling below that threshold of 95% of people being vaccinated that's needed to get what's called herd immunity, which is a critical number of people who basically act like barriers to the spread because they have adequate immunity from vaccination. And the real deal is this: before the 1960s, when the measles vaccine was introduced, measles infected millions of people and caused thousands of deaths worldwide. And since it was introduced in the late 60s, there's been a steep decline in measles cases. It was even declared eliminated in the year 2000. But since about 2018 or so, where the drumbeat of the vaccine lies have increased, we've been having these major outbreaks, which, unfortunately, as I mentioned, has led to the death of a child last week.
That's crazy. And I remember, I mean, as a child, we heard about the what is it? The pox, the itchy one.
Chicken
The chicken pox.
Chicken pox and measles. Like we would hear about that, like sort of hand in hand. But I hadn't heard about measles really since childhood. What exactly is it, Dr. Mel?
So it's a virus, and it has symptoms like you think of typical viruses: fever, cough, runny nose. But you also get red eyes and a really distinctive red rash, the measles rash. It's super contagious. It's spread by coughing and sneezing. Most people do fine, even if they get it. However, it can be deadly, as we saw, for young children, for pregnant women, and for people with weakened immune systems.
So I feel like what I'm hearing you say is vaccination is the best way to prevent measles. They're safe, they work, and they keep us from these outbreaks. They've kept us from these outbreaks for decades, which is why I don't know why I don't know what it even looks like or how it spreads.
Right. We haven't seen measles in a long time, so most people don't even know what it looks like.
It was.
You're absolutely right.
Back in the day, that was the thing: getting a measles shot and a booster. Pretty scary.
Right.
And one day I'll tell my story on it.
It is one of the booster?
When he was 6 years old.
It's one of the funniest stories from a 6-year-old you ever want to hear.
This is really scary.
It was scary.
I'm sure. I was gonna say I landed at LAX Saturday. I forget what day I came, but whatever day I landed at LAX, the next day there was a story about if you were in a certain terminal between a certain time, you could have been exposed to measles. So I took that to heart. It wasn't a terminal that I had been in, but could have been.
And you said that in Texas is over 160 people. Was it in Texas?
Yes, the most recent outbreak has been in Texas. Yeah, exactly.
Okay. Wow. Well, we wish everybody in Texas a safe time. Hey,
Yes,
Dr. Mel,
absolutely.
you know what everybody in my age group is worried about? Everyone is searching for the fountain of youth. Is it possible that researchers has stumbled across it?
Well, found a youth might be a bit much, but there is new research that suggests that a combination of taking a daily omega-3 supplement, vitamin D, and regular exercise, so think of it like a triple cocktail,
Mm-hmm.
may help to slow the aging process. So they did a trial, they looked at 700 adults aged 70 or older, and they saw that participants that took 1 gram of omega-3 fatty acids, so that's say like a one pill, 2,000 international units of vitamin D, another pill, and exercised 30 minutes just 3 times a week, experienced a slowdown in biological aging by approximately 3 to 4 months over a 3-year period. Not only that, they also saw a significant reduction in the risk of invasive cancer among participants that followed this regimen. So that's like a double benefit.
So that means if you so what are the best sources of omega-3 and vitamin D? And I'll come back to my first question, but what are the
Okay.
best?
So salmon and outside of the supplement, salmon and other fatty fish, cod liver oil is a huge way that you can get vitamin D. Adding chia seeds and walnuts to your smoothies or your oatmeal, your yogurt, are also great ways of getting omega threes. But the
Okay.
salmon and the fatty fish have both vitamin D and omega threes.
Oh, wow. And we should always consult with our healthcare provider before we start any new supplements or exercise programs.
That is always the best thing to do. Absolutely.
Okay. I want to say, so if you add 3 months, what is it, 3 months over 1 year of workout? What was it? How did they?
No. By doing those three things, it
Mhm.
slows aging by 3 months over a 3-year span of time.
So
So
you
you're
have to.
three. So after three years, you're 3 months younger than everybody else who's not doing that.
That's what I'm saying. So
Right.
the next 9 years, I'm going to add an extra year.
Almost. Just about. Yep. 9 months. Yeah.
Almost. I'm excited. I'm excited.
All right.
You excited?
I'm excited.
Well, orange, you happy?
I am
Moving on
happy. Orange.
to number three. Um, I recently read that eating citrus, which I love oranges and anything citrus, lemons, limes. But read that eating citrus fruits like oranges can lower the risk of depression by 20%. Can you break that down for us, Dr. Mel?
Sure. So there was a nurses' health study, two, was the second one they did. They looked at over 32,000 middle aged women, and they saw that those that ate one medium orange a day had
Mm.
20% lower risk of developing depression. And it wasn't just fruit, because they looked at apples, they looked at bananas. It was the citrus specifically.
Wow.
Specifically citrus. So, like, how does that work? Why citrus?
So the theory, and it's just a theory, is that citrus fruits promote the growth of certain bacteria in our gut.
Mm.
And that bacteria is correlated with it being able to increase the happy chemicals in our body. So dopamine, serotonin, that travel to your brain and increase and lift your mood. So hence the lower risk of depression.
Okay, it's interesting that citrus season is in the winter, because that's the same time that there's a lot of seasonal depression. It's almost like nature's giving us a remedy for those wintertime blues. Lane, you eat
Right?
some citrus in the wintertime.
Oh
We've talked
yeah.
about
I mean, yeah, I
seasonal
remember my
depression.
grandmother in Florida used to send me, or send our family, boxes of oranges and grapefruits every Christmas. That was the Christmas present. So, you know,
Really?
yeah, yeah. So it kind of matches up perfectly. But yeah, I am stocking up on those oranges, clementines, grapefruits, all the good stuff.
Okay.
All right. So what y'all think? Is it time? What y'all think?
You always so forward thinking, Dr. Mel. Like nobody can get one over on you. Cause what y'all think?
So listen, what y'all think? This is the what y'all think for today. Coming out of Orange You Happy. Sometimes we need a little pick me up, like to get through that Monday or to get that Monday started. So we are asking folks to drop your go-to hype song in the chat. Want to know what your go-to song? A lot of us have many, but just drop one song in the chat that gets you hyped up. Dr. Mel, what's yours?
Optimistic by the Sounds of Blackness. It gets me going every time. Yep.
So good.
What about you, Wayne? What's yours?
Right now, it's that young boy, that young man got me in a tizzy right now.
It got you in the chokehold.
He got me in a chokehold. They ain't like us.
Is that the name of the song? Oh, okay.
I mean, Kendrick Lamar, anything Kendrick Lamar right now got me hyped. I'm jumping through a window.
Okay.
Just
all
ready
right.
to go. But yeah, right now, overall, I mean, it's been some songs. I mean, it's so many. What about you?
Yeah.
What about you, Lai?
Mine is not my go-to. It's not the one I played this morning, but one of my favorites is Another Star by Stevie Wonder. It's just something about when the beat drops, it instantly changes my mood.
All right.
Yeah.
All right. Well, I hope everybody is dropping them in the chat. Yeah, because that might be the inspiration that somebody else needs, to make it through hump day and beyond.
Hump day.
All right.
All right, Dr.
Well,
Mel.
thank you guys. We'll see you back in a little bit. And we're going to move into skin deep, debunking these skin myths that are out there. Who alive has not heard that black don't crack, or that, oh, you don't need that sunscreen. We're going to be talking about some of the biggest myths in skincare, especially for skin of color. And we're going to leave no myth unturned. And we know that social media is not helping. So we have brought an expert, a board certified dermatologist who knows exactly what works and what doesn't. And she's going to help us separate fact from fiction. And her name is Dr. Paula Bourelly. She is a dermatologist in Olney, Maryland. She has over 30 years of experience diagnosing and treating diseases of the skin. Welcome, Dr. Bourelly. Thanks so much for joining us.
Hello, and thank you. I'm happy to be here with you, Dr. Mel.
All right. Well, we're going to jump right into it. So, a lot of people with skin of color in the Black community and beyond believe that we really don't need sunscreen because we have melanin. So what is melanin? What does it do? And is that true?
Well, let me start by answering that it is true that melanin is protective, but it probably doesn't give you as much protection as you think it does. And so we recommend that people, no matter what their color is, their shade, Black people, need to wear sunscreen even at moments when it seems like there's not much sun. You get a fair amount of sun even on cloudy days. We've lost part of our ozone layer, so you're getting stronger rays more days of the year than prior. And it may be the case that people think what you just said, Dr. Mel, because most people think of sunscreen as only being useful to protect against the harmful rays that cause skin cancer. That is absolutely true. Skin cancer is the #1 cancer diagnosed in the US and worldwide. In this country alone, there are 5.5 million cases, but it's no secret the vast majority of those patients are not Black. So that might be a tough sell when you tell people that. But Black people certainly do get skin cancer. And frankly, when we get it, we tend to fare less well for a whole host of reasons. But there's another very important protective reason that we like for people to wear sunscreen. It's because it helps to diminish the signs of premature aging that nobody wants, right? And particularly you started to talk about how many brown-skinned people worry about dyspigmentation, discoloration, brown spots developing. These are all signs of premature aging. Fine lines and wrinkles, textural change, inflammation, all of this shows up in our skin color, brown skin people. And the sunscreen and sunblocks are probably one of the best ways of defending against that.
Well, that is good to know, because I know there are many princess superficialises and prince superficialises out there in our audience, myself included, that don't want premature wrinkles and aging. So that is excellent advice. You also mentioned skin cancer, and we were talking about songs. Probably one of my go-to songs is Three Little Birds by Bob Marley and One Love. And we know, unfortunately, that he died of skin cancer. So is there anything different about the way that skin cancer shows up in people of color or darker skinned individuals than those who are lighter skinned?
Yes. So in the case of Bob Marley, he had a rare form of skin cancer, something called acrolentiginous melanoma. Melanoma is thought to be, or known to be, I should say, the most deadly form of skin cancer. Unfortunately, it is not a very common cancer, and even less common in people of color. But when people of color get it, they tend not to do very well. In fact, the 5-year survival for Black patients with melanoma is only about 70%. For white patients, it's more like 94%. So what's different? Melanomas can arise in brown skinned people in areas that never see the sun. So Bob Marley's, for example, occurred, I believe, on his toe, is a common location, palms beneath the nail bed. So that would be something that people always want to be mindful of. Now, before everybody checks themselves out and thinks they have this diagnosis, there's a lot of normal benign pigmentation that arises in skin color in those areas that have no connection to melanoma. There are also a couple of the rarer skin cancers that develop even more commonly in brown skin people than they do in white people. And I'll throw the names out there. Cutaneous T-cell lymphoma, which can originally present like just some hypopigmented or lighter areas of the skin. It can look like just a chronic eczema. But this is, in fact, a form of skin cancer that affects Black people more than white. And another rarer form, something we nickname it DFSP. That's the acronym. It stands for dermatofibrosarcoma protuberans. This is a rare one, but it can be very, very aggressive and very deadly, and it can actually look just like a very strange keloid. And that arises more commonly in Black people than white people.
So I think I'm not going to try to say that 5 times over and over. But I think the take home here is, if there's anything that you see showing up on your skin that wasn't there before, check it out with a dermatologist. Don't try to self-diagnose, right?
Yeah, don't we, as we mature, I say with birthdays, you get a lot of new things on your skin, right? So the vast majority of those lesions are going to be benign. I don't want people to panic, but I would say that when we try to gauge what needs to be evaluated and what doesn't, we go by the rubric, the ABCDEs. And very quickly, the A stands for asymmetry. If you're looking at a lesion, you want to try and visually just see if they're mirror images if you cut it in half. B is border. We like things nice and regular. If it looked like a star, that would be concerning. C is color. So if it has more than one color in it, if it's changing color, if it stands out different from everything else on your body, that might be the kind of lesion you have evaluated. D is diameter. Most people say anything greater than 6 millimeters, which is a head of an eraser, should at least be evaluated. And E is simply evolution. And that might be the most important one to remember. It used to look like this, and now it looks like that.
Those are great rules of thumb. Thanks so much for sharing it, because you're right. I mean, you're going to see a lot of different things, and if they seem out of whack from the ABCDE standpoint, definitely get it checked out. Absolutely. So on to something a little bit probably more common, and that is dry skin. We're in the middle of winter. Lots of people believe that drinking water is the only way to hydrate your skin. Tell us about the role of water, of course, but then are there other ways that we should be thinking about hydrating our skin?
Right. It's a great question, because this is the season. And there are a lot of the conditions that we end up treating in dermatology that frankly start off as dry skin, eczemas and the like, right? So I would say that water is crucial to the optimal metabolism and functioning of any cell in your body. The skin is no different than that. So yeah, absolutely stay well hydrated, but that's not going to do it for you if you're really suffering from dry skin. If you're suffering from dry skin, you need to grease yourself up. You need to moisturize. And there's some moisturizers certainly that are better than others. I'll just give you in general terms that from lotions to creams to ointments, you're going thicker. So lotions are a little bit more liquid. Ointments are like Vaseline. The thicker you are, the more moisturizing, the thicker the product you're using, the more moisture you're going to get from it. Some of the habits that we practice. So if you're someone who likes to take a shower every day, like many of us do, that's fine, but the shower should not be hot. It should be more warm. You should be in and out in 10, 15 minutes. You don't need to use antibacterial soap on every inch of your body. You can use a nice moisturizing soap. And then the minute you get out, you pat yourself dry. And you can almost seal that moisture in by putting on your moisturizer right at that moment. Last thing I'll say about that is there's so many people who I see who have this problem. They follow those rules, they do better, and then they stop. And they said, well, it didn't work because I have the dry skin problem again. And the reality is that you have to maintain this. We, as we get older, don't make as much oil. So the things we were able to do as a 20 and a 30-year-old showering with hot showers, 2-3 times a day, you simply can't do in your 50s and 60s.
I'm laughing because I am so guilty of that. I love me a hot shower. So
well, let me say to you that if it doesn't bother your skin, if you don't have an itchy skin or a dry skin problem, you can probably get away with it. But if you do,
okay,
you want to cut the temp down.
Got it. Okay. Well, let's switch from water to food. And, Wayne sort of jokingly threw out there the chocolate thing, but it's true. Some people say that eating greasy food and chocolate causes acne breakouts. Is that correct? Should we be cutting those things out if that's a concern that we have?
Sorry about my light. It's a motion censored light. So if you see my hand go up, I'm not asking a question. So it's interesting, the question you asked, because I have to tell you, if you'd asked me this question 5 years ago, I would have said, absolutely, that's a myth. Food doesn't cause acne vulgaris, the common form of acne that we typically see. There is another form of acne called acne rosacea that we know is absolutely triggered by what you eat, but that's a separate disease. But just in the last few years, there's been more emerging evidence to show that foods that are or diets that are high in fat and sugar, or any kind of a high glycemic index diet, can cause the surge in blood sugar, causes a surge in insulin, and that insulin can actually trigger increased production of sebum, also known as oil, and even androgens, which are the male testosterones. And both of those latter two things are absolutely connected to acne. So is Wayne going to get acne from eating those things now at his age? I don't know how old he is, but he looks like he has beautiful, clear skin. It's probably not going to be his issue. But if you're struggling and you do have acne and you find that these are, the food choices you're making, you may be doing yourself a disservice. The other thing, just as a sidebar that's interesting, has been determined that skim milk, not whole milk, not low-fat milk, skim milk can have sort of a pro-acne effect on people because that particular product tends to have more hormones in it. Now, we're not talking about the hormones that are injected, like the bovine growth factor hormone, just natural hormones. So that's one other thing to keep in mind. When you're treating someone with acne, you try to give them all the tools to, make sure that the regimen you put them on is going to be effective. And sometimes it does relate to diet and lifestyle.
Right. No, that makes sense. And, I think it sounds like sort of the family wisdom that was passed down. It sounds like there might be something to that in terms of avoiding things that are going to spike your blood sugar and potentially make acne worse. So, what about scrubbing your face harder to get rid of acne and popping your pimples? I hear that a lot. Is there something to that?
The something to that is that you should never do it. There's no good that will come from that. And particularly when you talk about acne and brown skin people, our pigment tends to be a little bit more labile, right? So if you ever have an injury or any kind of, inflammation, you may notice that you either heal lighter or darker than your normal skin. Well, if you start scrubbing your skin or if you start picking at your skin, you're going to make that infinitely worse. So there's really no occasion that a dermatologist is going to tell someone to use something to mechanically abrade, like the buff puffs that we grew up with. Your skin naturally exfoliates, right? Every 28 days it turns over. So you really don't have to do a lot to help it along. There are certain products that we use when we're trying to rejuvenate skin, or maybe even in the treatment of acne, that we use to try and help unclog pores. And that can cause a little bit of exfoliation, but never will we tell you, hey, it's a good idea to go on and scrub your face. Acne is not a dirty skin problem. So you really want to be as gentle as you can, especially if you're on medications to treat it, because many of the medications that we choose to treat acne make people a little bit more sensitive anyway.
Throw away those buff puffs. All right. And now you mentioned, when you do have a problem, especially if you have skin of color, that you can heal with dark spots. So, and that's, I think, a common concern among many people is dark spots. So, there's stuff out there on the internet, toothpaste and lemon juice, combining that, putting it on your dark spots. What's your take on that? And if that's not the way to do it, what's a good way to do it?
Okay, so that's not the way to do it. And I would actually have greater concern that putting toothpaste on your skin and leaving it, or lemon juice, would be irritating. So it might actually aggravate rather than help. So that's an easy no right there. When people come in with dark spots, if it's the result of something inflammatory, we call it post-inflammatory hyperpigmentation, or PIH. Oftentimes, if you're treating the underlying condition like acne, it will fade on its own. So you do have a little bit of time to do that. If you're not happy with the pace, with which it's fading, then we have other medical, options, right? We can either do chemical peels if we choose to do that. We have certain creams that have, lightening effects, like hydroquinones or tranexamic acid or kojic acid. Maybe some of these things are familiar to your audience, and they really do a nice job of lifting pigment when people are suffering from hyperpigmentation. And you got to put on your sunscreen. And I'll just take this moment to remind people, or let them know, because this is relatively new information, even for dermatologists, that even visible light, so the light overhead that keeps shutting off in my office when I don't move, can actually exacerbate your pigment. Blue light that comes from the screen of your device, we're now finding may actually cause some problems with hyperpigmentation in people who already suffer from that condition. So this is why we say put sunscreen on, even if you're not going to be outside. You get sun through your window, you get sun through your windshield. These are other sort of hidden sources, if you will, of ultraviolet radiation that might exacerbate your hyperpigmentation.
Right. And I just want to make sure everybody knows we're not talking about people that slather on skin lightening creams and bleaching so that they can get lighter overall. We're talking about specific areas of your body, right? Spot treatment where you have uneven pigment. Yeah.
That's correct. That's exactly right.
Yeah. So let's switch to hair and go straight to dandruff, right? So some people think that dandruff is because your skin, your scalp specifically, is dry. So they put a lot of oil on it. Does that help? And if not, what should they be doing?
So the real question is it truly just dry scalp? Like you've used products that are, very drying to your scalp, or you're doing certain practices with heat and so forth that really dry your scalp out? That would look a little different than the dandruff that flakes, that gets on your black shirt and embarrasses you when you go out to dinner. That is usually called seborrheic dermatitis. Seborrheic dermatitis is actually not a dry scalp problem. It's actually a greasy scalp problem. And this is where the confusion comes in. Sebderm affects probably 5 to 6% of the normal population. There are certain populations, people with neurologic problems and the like, that may have a higher incidence of seborrheic dermatitis. But let's just say the average person has a yeast on their scalp, which is considered normal part of your flora. If your scalp is very, very oily, that oil feeds the yeast and it allows it to multiply. And when it starts to overgrow, it gets very irritating. So it could manifest as red scale along your forehead, red scale in your scalp. May not look red. It may just be kind of like a greasy scale that can be quite itchy. Other places for sebderm, right around the nose and the eyebrows and the ears. And so if you're trying to determine, do I have actually a condition called seborrheic dermatitis, or is it just that my scalp is too dry? Those are a couple of features that you can check. If that is your diagnosis, one of the things that we recommend people do is actually to shampoo a little more frequently. which
can
be a little bit complex depending on how your hair is and what your hairstyles are and so forth. So we do have different recommendations for people who cannot shampoo frequently. But let's just say if your normal routine is that I usually shampoo once every 2 or 3 weeks, but now you're really struggling with that condition, seborrheic dermatitis, we might say, why don't you start trying to shampoo every 10 days? Why don't we make a recommendation of a medicated shampoo for you? And if you're really struggling, we might even give you a leave-in product like a cortisone just to tamp down the inflammation so that you can start seeing results faster.
Got it. So again, if you see that redness with the flaking and the itchiness, go see a dermatologist or your primary care as a start, just to get some treatment or ways that you can more effectively treat it.
Get a clear-cut diagnosis. And let me just make one other point, that in brown skin, it may not show up as red. It might be a little lighter. It might look a little bit more purplish in terms of just how inflammation shows up in darker skin. But what will be consistent is that it usually itches. It's usually kind of a greasy flake, and it can happen in your scalp, in your ears, eyebrows, right around the nose. Those are other areas where people tend to suffer from seborrheic dermatitis.
Great point. Just to mention that certain skin conditions do look different on skin of color. My own little personal story was I developed chickenpox when I was, early in my medical training.
Wow.
I was working in the intensive care unit. I talked to multiple different dermatologists, infectious disease doctors. I was like, what's this rash that's suddenly come on me? They were like, I don't know, but stop by employee health on the way home. By the time I got to employee health, it was an older Black woman who was the receptionist, and she took one look at me and knew exactly what it was.
Wow.
Said, baby,
wow.
you got chicken pops. And then
Wow.
the doctor who treated me in employee health was Indian, and he immediately recognized what it was. So yes, different skin conditions look different on darker skin. And so to that point, do you think it's necessary, if you're a Black person, to go to a Black dermatologist, or if you have skin of color, to go to somebody who is a dermatologist of color? Just your opinion.
My opinion. Well, let me just say, I'm going to say the answer is that is a luxury. If you have that option, I think it's fantastic. And I think you will never be sorry if you take advantage of it. The reality is that of the 330 million people in this country, 14% of us identify as Black or African American. Of the 12,000 dermatologists in the country, there are only 3% of us who are Black. So we just don't have the numbers to make ourselves available to every single person. So I would say that it's a real luxury if you can see somebody who looks like you. I feel like it always feels great to be taking care of somebody who looks like you. But more importantly, you want to see somebody who you feel has experience and exposure and is comfortable taking care of not only Black skin, but Black patients. And that does not have to be a Black person. How do you find that out? That's the tough one. Sometimes it's word of mouth. You talk to your colleagues, your friends, your hairdresser, and they'll say, oh, you have to go see Dr. So-and-so. They're really, really good. Sometimes, just paying attention to the location of their office, right? That'll help you understand what's the demographic, what's the community that they're serving. You can even cheat and look on their website and see what kind of pictures they post in their photo gallery, or where their education was. Because I'm going to tell you, no matter what your color or your race is, if you train in DC or if you train in New York City, you are taking care of a variety of patients. Diversity, I should say. So it would be a luxury, but I don't think it's absolutely essential. Anybody who is board certified as a dermatologist in this country should really be able to take care of you. There may be a little bit of nuanced stuff that you have to work with, but you absolutely should be able to get good care.
Excellent points. Thanks so much. And I do have one question before we go to the audience. I just want to round out with, and that's, skin influencers on social media. The folks that are getting up there with products, claiming everything from anti-aging to acne relief and everything in between. What are the biggest current concerns that you should highlight, that you can highlight about skin products that are marketed on social media? What should people be looking out for and be concerned about?
I mean, listen, there's so much. I have to say, I don't want to be the one who takes all the fun out of internet shopping, but I would simply say that if you have a skin problem, you know, an influencer, which sometimes ends up being someone who's not only influencing, but recommending, do you know what their background is? Do you know what their credentials are? Are they really qualified to make these recommendations? What connection do they have to the product that they're actually marketing? So you can really find, I think, you know, there are always interesting things that are being talked about, but I think there's absolutely no guarantee, and you deserve better healthcare than that. So if you're someone who has a skin problem, I wouldn't rely on an influencer to tell me how to remedy that, whether it's eczema or acne. If you're someone who doesn't have a skin problem, I'll just caution you that sometimes the stuff that's recommended may not be suited for you. And now you have a skin problem as a result of the stuff that you use. So I'd be really careful about taking, you know, too much of that information to heart. Now, if you want to do your own little quick research, there are a couple of tricks that I do, because listen, even, you know, dermatologists can't keep up with everything that's being sold out there. And now things are coming in from other countries, right? So, and I should mention this also, that many of these products are what we call cosmeceuticals. So they're not really drugs. They don't, you know, prevent or treat disease, but they're not just cosmetics, which are really just meant to beautify. They're somewhere in between. That's not regulated the way that regular drugs are. The FDA doesn't even require pre-marketing approval for that. So they really rely on the people who are manufacturing and distributing those products to voluntarily register them, right? Say what they have in them, say, you know, what they're used for. And so you can imagine that that could turn into a real mess if you don't know who or what the product, you know, it is that you're thinking about buying or you're listening to. Yeah.
Right. So it could be the Wild Wild West.
It could be the Wild Wild West. And I was going to tell you one other little trick is that I tend to go and find out, okay, what's the scientific name of, you know, product, you know, I don't know, product 11. Can they give me any ingredients? Because if I can get one or two ingredients, I can go not to Google, but to Google Scholar. When you go to Google Scholar, it'll pull up all the scientific papers that have that particular search word in it. And then now you can see, does green tea oil really help with, you know, with wrinkles? And then you can go from there, and you can at least start to have a conversation with your dermatologist or do your own research if that's what you choose to do.
I think that's a great tip. Well, I can't believe it's time to bring Wayne and Lila back in, because they have what is going on in the chat, and they can let us know, you know, what folks are saying, any contributions to the conversation, or more importantly, questions. So what's going on?
One of the questions that continues to come up is, what exactly is a chemical peel? So, doctor, if you could break that down, and is it safe? How safe is it?
So chemical peels are usually a combination of certain acids that are used to literally peel your skin, right? And they do that by separating the outside layer of the skin. And depending on if it's a superficial, a medium depth, or a deep peel, that'll dictate how deep you want to go. And I will tell you, most of us don't do deep peels anymore, because now we have lasers as a much safer and more effective alternative. Deep peels can really cause a pretty significant burn in your skin. Doing superficial and medium depth peels are considered safe, but they're always risk associated, right? And now that we're talking about skin of color, the one exception I'll make, Dr. Mel, to the earlier question, if you're a Black patient or a skin of color, you know, patient, do you have to see a doctor who looks like you? I would say when you're doing cosmetics, you want to be really, really careful about who you go to, because what can be done in brown skin and what can be done in white skin, it can be vastly different, number one. And number two, for those of us who treat a lot of brown skin and do cosmetics, there's certain things that we may want to do to pre-treat you so that you don't have adverse effects. So the answer is they can be safe in the right hands, but you certainly want to go, I think, to a dermatologist or someone who has a great deal of experience in that type of treatment, and someone who is accustomed to taking care of patients who look like you, more importantly.
And the purpose of a chemical peel? Like, why would you want to get one?
Yeah, so you could do it for skin rejuvenation. Some of the superficial peels are really just meant to sort of retexturize. They can help to lift some of the dark pigment that we just talked about. Medium depth peels as well. People use them for fine lines and wrinkling. Sometimes we use it to treat acne.
Mm-hmm. Got it. Great. Thanks.
Wow.
What else is
Wow.
out there?
The questions are just pouring in now, which is really cool. But we have a couple. One is about medications. So some of our medications from Yvonne Smith, some of our medications make us photosensitive. And does that mean sunscreen is needed in the winter?
Oh my gosh. I wrote a little sticky to myself. Please thank that person, because I said, please don't forget to say photosensitizing medications and photosensitizing disorders. Lupus, dermatomyositis, some things that absolutely affect people of color will make you more sensitive to sun. Absolutely. And so all the more reason for you to wear sunscreen. You know, brown skin patients who have vitiligo, where you actually lose the pigment, are at very high risk of burning and getting the damaging effects of sun. So thank you to the person who put that in the chat, because that's a really important point to remember. Some of the high blood pressure medications that many of our, family members are on make them super sensitive to the sun. Antibiotics also.
Okay.
Thank you, Yvonne.
Thanks, Yvonne. Or you want me to go?
Yeah, no. Lauren Powell asks, what is the best way to care for and prevent peeling skin of the lips?
Well, you have to figure out why your lips are peeling. If I can just say that, first of all, if it's a dry skin problem, we talked a little bit about, good old fashioned lubricants. The thicker, the better, the greasier, the better. And I would actually try and stay away from things that have too many added ingredients. Like, I don't need vitamin E in my Vaseline. I don't want that. I don't want something that has menthol to make my lips feel, cool and refreshed. I just want something that's going to lubricate. So if it is purely a dry skin problem, then that may be something that helps you. But oftentimes, peeling lips are really more of a manifestation of either an allergic contact dermatitis or an irritant dermatitis. You've come in contact with something, and now you're starting to react to it. Sometimes it happens in people who are prone to eczema, who are lip lickers. Sometimes it happens to people who are sleeping in, mouth guards that have dental whitening agents in them. So knowing what your cause of dry and peeling lips is going to be super important. Oh, here's another one. For some people, eating mango with the skin on it will cause them to have a reaction, which is a form of an allergic contact dermatitis. So identifying what your cause is probably the most important thing. And then once you know the cause, you can eliminate it, and then you can treat it. And, the treatment will be variable depending on what the diagnosis is.
Wow. Say that about mangoes again.
If you're eating, is that a real question? People who eat mangoes, like me, my father was from Haiti, so we ate a ton of mangoes, do very well with the fruit. But sometimes if you're eating it with the skin still on, something in the skin can cause you to develop an allergic contact dermatitis. Not to everybody, but for some people. And so that's just, lacquer nuts do it also. So that's just something to keep in mind if you're having a problem with your mouth. Yeah.
Mango is my favorite fruit, and luckily I don't have that problem. So
good.
All right. What else is out there?
For me, when my lips are dry, it's because I'm dehydrated. So there's that.
And there's that. Yeah.
You'll never go wrong by consuming more water, to be clear. I don't want to make it sound like that's, I'm blowing that diet, that remedy off. It's just oftentimes not enough for people, but yes.
Yeah, true. Of course.
Absolutely.
Skin tags. Did we talk about skin tags at all? I don't think so, but it's coming up in the questions in my phone. What are they? And as an African-American woman, I see a lot of African-American women with them. Is there a way to combat?
So I'm going to go out on a limb and assume that the person who's saying this might be talking about the little brown moles that come on your face as skin tags, because the true skin tags that we refer to in dermatology are oftentimes in hidden areas like armpits and groins and so forth. So the answer to the question is, what comes on the face of many brown skin people are called seborrheic keratoses. And when you see them in this collection on the side of the face, they almost look like freckles. It's given this long fancy name called dermatosis papulosa nigra. DPNs, very common, absolutely benign, only of cosmetic significance if you don't like the way they look. Some people like the way they look. People always say, do they run in families? Because my mother and my uncle and everybody had it. I don't know that there's really a genetic predilection for them, but they're so common in our community that you do see them in multiple members of the family. So is there anything you can do to prevent them? No. But there is something you can do to treat them. We treat them all the time here. We remove them. Sometimes people, grow some back, but, it's kind of like clearing your skin of it. And maybe a few years later, you come back in and do some touch-ups. Very easy to do. Again, something that I would probably love to see a person do on you if they are familiar with that kind of treatment in brown skin, but absolutely benign and not anything that you can't get treated if you want to.
Okay, thank you.
Got it.
So we have from Rhoda Lawrence, there are so many chemicals in makeup. Are you seeing any new trends or ingredients that are particularly unsafe?
Well, I guess I would have to say, I can't say that I'm personally seeing that, but every year we go to a few meetings, most of us in dermatology, big meetings, and there's always one section purely on allergic contact dermatitis, and a lot of these products are cosmetic agents. So I don't have a particular one in makeup. I would say that just like your GI doctor may say, try not to eat too many foods that you can't pronounce with very, very long, list of ingredients in them. Less is more when it comes to products that you put on your face. So if you can get something that has fewer ingredients, something that's fragrance free, that goes for your body care products as well, unless, of course, we're talking about deodorant, which has to have fragrance. And just remember that everything that says that it's, all natural doesn't mean that it can't cause a reaction. Everything that says it's fragrance free doesn't mean that it doesn't have a fragrance in it. It might simply mean that it has a masking fragrance on top of the fragrance so you don't smell it. So you can react to any number of things. And if you find that you're repeatedly reacting to something, then it's time for us to send you to a dermatologist or an allergist who can do a skin test on you and figure out what chemicals don't sit well with you. And you can just learn how to label read and avoid them.
Oh, wow. Dr. Bourelly, what is your skincare routine, if I can ask?
You can ask, and it might be a little disappointing, but I will say to you that I use glycolic acid cleanser on my face. I like to do that. It's rejuvenating. I have one that I carry in the office. You don't have to use mine. There are plenty out there, but be careful what you use because sometimes glycolic can be a little bit irritating. I don't know if I can use brand names here, but I'll just say I'm a big fan of Retin-A, tretinoin. And it is my firm belief that if everybody could use Retin-A as an anti-aging cream, which, by the way, it's not only anti-aging, it was originally used as an acne cream, and it continues to be a very potent acne cream. If everyone can use that, I would argue that there would be probably hardly any other products on the market. The reason you have so many other products on the market is a lot of people can't tolerate Retin-A, but I've been doing it for a long time, so I do use it. And last but not least, I will tell you that there's not a day that I get up that I don't put some part of sunscreen on, even if I'm not leaving the house.
So, wow.
So glycolic acid, Retin-A, and sunscreen. All right.
Sunscreen.
So that brings us
and I don't do it every night. I mean, everybody thinks that, we are better than everybody else, but we're not. I do it most nights that I can remember to do it, and I stay awake long enough to do it. But I've been doing it for a long time.
Wow.
Got it.
We have a Michelle Walker scale. She said, what's a good everyday facial sunscreen moisturizer to use?
So I can rattle off the names of a number of companies that make sunscreens, but let me just make it easy for you and say the one that's going to be the best for you is the one that you're going to use, meaning it's not too pasty white on you. It suits you. It's cosmetically elegant. And the nice thing about sunscreens is that they're considered drugs by the FDA. So that means a sunscreen by Coppertone is going to be equally effective to one by the CVS brand, but you may like one better than the other. So you always want to have an SPF of at least a 30. I would say for brown skin people, you want to make sure that you don't have anything that's too opaque. Sometimes when you go higher in number, it gets a little greasier. It starts to leave this white film on your skin. So, in my office, I like Anthelios. That just happens to be, one that they also sell in drugstores. But just in the last couple of years, you'll see there are a number of companies now, including CeraVe and Neutrogena and Aveeno, that have come out with sunscreens with different tints to them.
Sure.
So we have, for fair skin, for medium complected, for brown. I'm not guaranteeing that you'll find one that you like, but I'll simply say that you want to just get something that's SPF of 30, that's preferably hypoallergenic. So the big houses that I just named, Cetaphil, CeraVe, Aveeno, Eucerin, they all have nice ones. They're all over the counter. If you want something a little bit more, cosmetically elegant, then you'll find that in a dermatologist's office. I won't rattle off names there, but you can absolutely get that. And I should also say that if you have a makeup that you love that has an SPF of 30, that also counts. I don't need you to smell like pina coladas. I just want you to have something on that says with SPF of 30, and it could very well be your makeup. So that works.
Thank you for saying that, because I was gonna ask. I use a tinted moisturizer that has the sunscreen in it. It's one of my favorite products. Yeah.
Perfect.
Okay.
Perfect.
All right.
Dr.
I'm gonna have to get that from you afterwards, Lila. All right.
Yeah.
Dr. Mel.
All right. I think that is is that the warning sign to wrap up? I mean, I was having so much fun.
We're gonna have to do a part
these
2.
questions.
I have to
We
call
probably
Dr.
do.
Bourelly. Can you do a part 2 with Dr.
I would
Mel?
love it. I would love it. This has been fun. Thank you. And I congratulate you on what you do, because I think it's so important for our community to have this kind of resource. So thank you for allowing me to be a part of it.
Well, thank you for being here. And it's experts like you that we really rely on to make sure that we stay health empowered and be health empowered, which is our slogan here. And so thank you again for being here. Thank you, of course, to Lila and Wayne for all that you do, and also to the Be Health Empowered family. Thanks for joining us. We will be back. And until then, be wise, be well, and be health empowered.